So this slide lists the repertoire of epidemiological studies. And now we're going to discuss experimental studies, more specifically clinical trials. First, though, I'd like to provide a few definitions. An experiment is defined as a series of observations made under control of the researcher and is performed prospectively. A clinical trial is a deliberate experimental testing of a medical intervention or some sort of treatment performed specifically on human subjects, and this clinical trial must possess important general characteristics of the scientific method that are stated here. It's important to note that any prospective observation of subjects or individuals without an intentional intervention is not a clinical trial. It, in a sense, would be a prospective observational study, such as a cohort study that we've discussed already. Now, there are a myriad of areas of clinical research, everything including studies of disease mechanism through studies of evaluating healthcare delivery efforts and modes. You can essentially apply the concepts in these next few lectures to any of these fields of research. Now, the general purpose of a clinical trial is to prospectively test a hypothesis in a controlled setting among human subjects. It also is to test or reinforce findings from prior studies that may be unconvincing, perhaps due to the sample sizes of those prior studies being too small, such that there's discordance among prior studies. There could also have been bias in published studies from the past, and so an effort to derive a more valid estimate may be the goal of the current clinical trial. In general, there are two kinds of clinical trials. In principle, the first would be an explanatory trial, and here our goal is to evaluate the efficacy of the intervention in a controlled setting among a group of individuals who meet very specific inclusion-exclusion criteria. So an explanatory trial has great internal validity, but may not have a vast external validity or generalizability. And then in contrast would be a pragmatic trial, and this trial is is also an interventional trial, but it's performed in a more broad population who have less inclusion-exclusion criteria requirements. And the goal of these sort of trials is to assess the overall effectiveness of an intervention or a program. So typically in a clinical trial, to evaluate a new treatment or device or assay, we are aimed at evaluating the efficacy of that intervention. And then once that efficacy has been established and the product is available for more wide use, then the effectiveness of that product is often of interest. The history of clinical trials goes all the way back to the Old Testament, at which point Daniel wrote of an experiment to study diets between the king and the Israelites. There was a poem written in 1300 AD regarding a large study to show harm created by physicians. The first comparative trial of record was that performed by Dr. Lind among 12 men on 12 sailors suffering from scurvy, and that trial included 6 treatment groups. And we all know about John Snow and his evaluation of the cholera epidemic in London. Moving forward, we had Dr. Semmelweis's first prevention study performed to evaluate efforts to reduce the incidence of childbed fever. In 1924 was when we had the first clinical trial that utilized randomization, which is a method to randomly assign interventions, and I'll discuss that in a bit. And then in 1931 was the first clinical trial where there was a blinding approach, blinding being a method to ensure that the volunteers or participants of a trial do not know what treatment they are receiving. Now, why are clinical trials so important? Well, they are viewed as the best approach to definitively prove that an intervention does what it's hypothesized to do. And it is because of known variability of diseases and natural history unknowns which prevent uncontrolled studies from being able to confirm a treatment effect. So a clinical trial that includes a control arm can essentially establish or confirm a treatment effect. And as a side note, even for uncommon or rare or even life-threatening diseases, a clinical trial must or should include a control arm in order to confirm a treatment effect of whatever sort of intervention exists. And there are plenty of examples in the literature where data from observational studies refuted those from clinical trials. One of the biggest examples is from the Women Health Initiative, which showed in an observational study that there was a reduction in the risk of coronary artery disease, or CAD, among women receiving estrogen plus progesterone hormone replacement therapy. And then subsequent to that, a large clinical trial found just the opposite relationship. And the prevailing view at this point is that there is indeed a risk associated with this increased use of these hormone replacement therapies. Now, clinical trials are not always feasible or doable. That often is true if there's a disease for which the treatments that exist would show little to no variability, so it'd be difficult to detect an effect in a clinical trial. Also, it's difficult when you have a rather rare disease that has a uniform outcome, so it'd be very difficult to observe an effect if there was an intervention. There are oftentimes ethical or practitioner beliefs that prevent the inclusion of a control group in a clinical trial. We saw this during the Ebola epidemic, during which researchers were focused on evaluating new Ebola treatments, and there was a lot of discussion and debate as to whether or not those trials would include a control arm. Suffice it to say, the control arm filled one, and that trial was completed. And then if we think back to the AIDS epidemic at that time, it was moving along so quickly that it was essentially impractical and impossible to implement a clinical trial under that setting fast enough to have an effect on the dramatic increase in mortality. And then sometimes exposures cannot be randomized. If we're interested in the relationship between a harmful effect and a negative outcome, such as smoking and lung cancer, it would clearly be inappropriate and unethical to randomize people to smoking or not smoking. It's also debated as to whether or not it's appropriate to perform a clinical trial to prove a harmful effect of a treatment. However, there are clinical trials to date that have been designed to show an effect of increased risk of, say, mortality or heart attacks given certain treatments. Clinical trials are also not useful to prove mechanism of actions of drugs or interventions, nor of diseases. And they're clearly not useful to evaluate the change in the human condition. That's what epidemiological observational studies are useful for.